The sudden death of actress and model Shefali Jariwala has sent shockwaves through the entertainment industry and beyond. Just 42 years old, she passed away from a sudden cardiac arrest, a tragedy that's becoming alarmingly common in India. But Shefali's case is not an isolated one. From celebrities to everyday professionals, heart attacks are now striking young Indians with growing frequency. And the data shows this is no longer just a lifestyle issue, it's becoming a national health emergency. Doctors and data both point to a disturbing shift. Cardiac problems that once affected people in their 50s and 60s are now increasingly showing up in those as young as 30 or 40. It's not just reflected in hospitals but also in pharmacies. Sales of heart failure therapies, life-saving drugs used after cardiac events have nearly doubled in 4 years. At the policy level, this crisis is now hitting the government's flagship health scheme Aushman Bharat. The scheme, which aims to provide free secondary and tertiary care to over 50 crore Indians, is now witnessing cardiovascular diseases as one of its top causes of hospitalization and claims. According to the latest data under the central government's flagship Aushman Bharat, the maximum number of claims are for an angioplasty procedure that involves putting stents in the arteries of the heart to remove blockages which could prove fatal. The scheme serves as health insurance for the bottom 40% population of India who are extremely poor and vulnerable, busting the myth that heart ailment is a rich man's disease. The data shows that a whopping rupees 1051 crore has been spent by the way of claims under the scheme so far on the procedure named PTCA, inclusive of diagnostic angiogram. This is the procedure to perform angioplasty after an angiography is conducted which shows blockages in one's heart. India is facing what Apollo Hospital's Health of the Nation 2024 report calls a silent epidemic of non-communicable diseases, particularly cardiovascular disease. The number of heart disease cases jumped from 380 lakh in 2005 to 641 lakh in 2015, and the numbers are still climbing. Lifestyle risks are a major culprit. Apollo's 2023-24 report shows that in 2019, conditions like high BP, cholesterol, obesity and poor diets contributed to 27% of India's total disease burden, up from 21% in 2010. These risks are tightly linked to heart diseases, strokes and early death. Doctors warn that modern work life, high stress, long sitting hours, fast food, gym misuse, sleep deprivation is creating a perfect storm for young heart failure. And the warning signs are often missed. Many young patients have no known history, no classic symptoms and no idea they are at risk until it's too late. From Shefali Jariwala's shocking death to surging drug sales and Aushman Bharat's burden, the message is clear. India's heart crisis is not only real, it's getting younger and moving rural. Unless we prioritize early screening, lifestyle correction and public awareness, this silent epidemic will cost us our future, one heartbeat at a time. While we have focused on increasing incidence of heart attacks, we must also consider the side effects of anti-aging drugs and injections like hormone therapies such as testosterone or growth hormones, which can increase the risk of heart attacks if not used carefully. These treatments may play with blood pressure, thicken the blood or increase cholesterol levels, all of which strain the heart. Also, one very popular anti-aging injection, glutathione, which is otherwise a popular and very powerful antioxidant, can lead to sudden fall in blood pressure levels, causing heart attacks. In Shefali's case, we know she was suffering from epilepsy since she was 15 years old. It means she might be managing this condition via some medications. Hence, if anti-aging treatments are taken without proper medical supervision, they can trigger serious issues like heart attack. Also, for people living with epilepsy, there is a rare condition called SUDEP, SUDEP. There exists a rare but serious risk of sudden unexpected death in epilepsy. It leads to unexplained death of someone with epilepsy who was otherwise healthy. Though this condition is rare, affecting approximately 1 in every 1,000 people with epilepsy each year, it tends to occur in those with chronic or poorly controlled seizures. In this case, this angle should also be investigated.